This is Boomer Life on CL 650.
Welcome back. This is Boomer Life on CL 650. I'm Joanne Sutton. Joining us in the studio today from HomeCareAssistance, we have President Carolina Arosa and Jay Arosa, partner and director. Now, we do a lot of work with the Alzheimer's Society of British Columbia here at CL 650. We're very familiar with some of the statistics and the fact that over 747,000 Canadians are currently living with Alzheimer's or another form of dementia. Worldwide, that translates into at least 44 million people living with dementia, more than the total population of Canada, making this disease a global health crisis that needs to be addressed. So a diagnosis of Alzheimer's is absolutely life-changing for that person with the disease, but also as well for their family members, their friends. But information and support are available. We're trying to help educate the public about that you are not alone and nobody has to face this diagnosis of Alzheimer's or dementia alone. And I honestly believe that this is where HomeCareAssistance jumps in and helps fill a gap in that, and your understanding of this specialized care need. You've done a lot of research for this to ensure that any client of yours that's been diagnosed with any level of Alzheimer's or dementia gets the proper care.
Absolutely. And Joanne, this is an issue that's really close to my heart because my father was diagnosed with Alzheimer's as well before he passed away. And so this is an issue I feel very personally about. And this is also what helps me relate to the number of clients. We have a huge number of clients that suffer from this. So I can actually tell their family members, I've walked in their shoes and I know what they're going through. And so I can confidently say we are experts in dementia care for a number of reasons. Number one is the fact that we're the only agency that has our very own cognitive therapeutics program. And like I mentioned before, this is a program designed by our in-house neuropsychologist that is a series of workbooks and tools that are sort of non-pharmacological interventions to help address cognitive decline. This is proprietary to us, and this is something that our caregivers do one-on-one with the clients in their homes. That's the first thing. So secondly, my case managers are all certified dementia practitioners. Again, they're social workers and nurses who have gone through specific and specialized dementia training to be able to be, again, a better resource and advocate for their clients.
And you've offered that training to them?
Yes, I've made it available to them through outside parties because it was important to me knowing that the epidemic that we face. Third is through our free home care assistance university that we make available to our caregivers. We have a number of specialized dementia courses that we offer to our caregivers through that university that take them through a whole gamut of, courses on how challenging behaviors, triggers, communication techniques, and whatnot to deal with our clients who are suffering from dementia. So I think all those put together, can help supplement the fact that this is something we take seriously, and this is an area that we've definitely tried to make a mark for ourselves in.
Mm-hmm. I think it does matter that you've had a personal connection as well, because you understand the importance of it. So obviously it's the safety and the well-being of the client is first and foremost.
Absolutely. And I think it's also about understanding what they're going through, understanding the journey. So I always tell, the family members who call me and who, ask for help for their clients with dementia is the most important thing you can do for your family member is educate yourself on the condition so that you understand what your loved one is going through and how you can help them through this journey as they go through it. So,
and just wanted to add to that point. I mean, in terms of educating themselves in the disease state, there's lots of great resources out there. The Alzheimer's Society is excellent with sharing with families in terms of what to expect. And also, another important point is there's a number of different, people use Alzheimer's quite loosely, but that's actually just one form of dementia. Dementia is the blanket term. And there's a number of different types of dementia, such as Alzheimer's dementia, vascular dementia, mixed dementia, Parkinson's disease dementia. And each of these different, and there's more that I can't name because of time, but each of these sort of has their own different characteristics and manifests itself in certain different ways. So it's really important that they get together with, different resources out there. One other thing that I do want to point out, maybe taking it a step back, is that if anyone out there does maybe suspect that they have a parent that might be suffering from some form of dementia, maybe because they're forgetting things or there's some memory or cognitive issues. Um, I think one of the challenges in our system is that most people are followed by a GP or general practitioner. And while there's a lot of excellent general practitioners that provide great service out there, really, because our system is overwhelmed right now, the average time that a patient gets with a GP would be anywhere from like 5, 10, or 15 minutes. And to do an actual assessment to determine whether someone has a diagnosis of dementia, that can take upwards of about 30 minutes or more. So typically they have to be referred on to a specialist. And throughout the Lower Mainland, I mean, you look at different wait times to see specialists, they can vary from like 3 to 4 months all the way up to 9 to 12 months. So it's important to know that, it would be really good to reach out if you suspect or if you have a parent that maybe you do know has some form of dementia. Reach out beyond just your general practitioner, reach out to the resources available in community. And we are one of those resources that might be able to provide some level of help, especially when you're waiting to be referred on to a specialist.
Sort of bridging that gap.
Absolutely.
Yeah, absolutely.
Oh, that's a great. I hadn't even thought of that.
Yeah.
Now, also, you mentioned earlier in the program about your close association that you work with independent living communities, assisted living communities, and extended care communities. Do you work closely at all with any of the resource groups like you had just mentioned, or the Alzheimer's Society or Parkinson's Society? You must have some level of relationship with them.
Absolutely. I mean, a lot of the associations, they tend not to partner exclusively with any private company per se, for good reason. But we, as much as possible, try to find ways to participate and also to support them in terms of providing education to the different communities that we serve.
And staying current.
Yeah, absolutely. And staying current with everything that people need to
And
know.
I think we've gotten a lot of good reception from all these different associations because, again, I think they see that our values are aligned in terms of what we're trying to accomplish with the clients that we serve. Again, it's about, not just providing the basic care. It's about understanding them and helping them on this journey that they're taking. And so that's very much our philosophy as well as the different associations that we partner with.
Okay, you mentioned journey. In our journey of life, and just recently we had a big conversation about end-of-life care. How does home care assistance play in a role of palliative care?
Again, that's definitely an area that we have a lot of experience with, sadly, but an area that we can provide a lot of assistance with. Again, it boils down to the fact that the case management that we offer. So my case managers are very seasoned, having dealt with this over 20 years of experience in social work and nursing, being able to be a support for the family as they're going through this difficult journey. So our case managers do advanced care planning for our clients. So again, because we're in the home, we're able to see firsthand, we're eyes on the ground, how our clients' conditions are progressing, and we're able to then step in and do this advanced care planning with the family members, as well as liaise with different healthcare professionals in the field, the palliative team, the doctors, to ensure that the rest of the life of our clients are lived with dignity and in comfort and in peace. And so really that's our goal for each and every one of our clients. And, so far we've been able to help our clients sort of transition, with dignity.
It's very reassuring.
Yeah.
I know we didn't talk a lot about this today, but we will in the future. And I've seen the information on your website as well about post-hospitalization. That's a big category, isn't it?
Yeah.
Yeah, definitely. And there's, if you look at, there's so many statistics, and we can just kind of go on and look at the different numbers in terms of statistics that occur as far as people being discharged early from the hospital. Maybe they're not fully ready yet, but and that's happening because a number of our hospitals are overwhelmed with having to make sure they have free beds for people coming in and being admitted into hospital. And we'll go. I guess we'll have an opportunity in the future show or program to talk a little bit more about this in detail. But suffice to know that when it comes to being discharged from hospital, there a lot of times there's the public home support that we work with them quite closely, but because they're overwhelmed, sometimes they can't get to a number of these patients early enough when they transition and where discharged and they head back home. So a company like us, HomeCareAssistance, is able to fill in that gap where, as Carolina mentioned earlier in the show, a case manager is able to go into the hospital, meet with the family, meet with the client or the patient, meet with the physician, meet with the physical therapist, occupational therapist, social worker, discharge planner. Make sure to get all that information before a client is discharged from the hospital to make sure that when they get back into their home, they have the right support in place to make sure that they're able to rehabilitate and that they won't find themselves back in the hospital.
And continue to improve.
Yes.
Well, this has been a great conversation today. Absolutely wonderful about home care assistance. If you wanted to leave us with any one thought today about, you know, your philosophy, or if we were to remember one thing from today's show, Carolina, what would you want it to be?
I think it would be that Home Care Assistance isn't a caregiver drive-through agency. We're an agency that provides a holistic approach to care that is different from anything that's being offered in the market out there. And what that means is that your loved ones are going to live not just longer lives, but happier, more purposeful lives. And that goes back to our mission of changing the way the world ages. So.
You're listening to Boomer Life on CL 650. I'm Joanne Sutton, joined in studio today by our friends from Home Care Assistance, Carolina Arosa, President, Home Care Assistance, and Jay Arosa, Partner and Director at Home Care Assistant. There is more information available online. Please visit the website, HomeCareAssistanceVancouver.ca. Thank you both for coming in and sharing your story today.
Thank you.
Thank you.
I'm Joanne Sutton. Thanks to you for listening. This is Boomer Life on CL 650.